Good morning. My name is Daryl Doise, and I'm Executive Vice President of Growth and Strategy at Oceans Healthcare. It is truly an honor to be here today celebrating the opening of our new flagship campus of Oceans Behavioral Hospital, Baton Rouge. Last summer, we announced our partnership with the city to bring much-needed healthcare services to the residents of this area and support the redevelopment of North Baton Rouge. Thanks to the support of Governor Edwards, Mayor Broome, Baton Rouge city leaders, and of course, the residents of this community, we are delivering on that promise today. When we open our doors, Oceans Behavioral Hospital, Baton Rouge will provide inpatient behavioral health care to mature adults. This new 40-bed facility provides a dedicated space for treating these individuals while creating additional capacity beyond the services offered at our existing Baton Rouge Hospital. Together, our two inpatient campuses will offer 60 inpatient beds. Our Baton Rouge network also includes an intensive outpatient program for adults 18 and older, which will relocate to this building in the coming months. As the largest behavioral health care provider in Louisiana, we are seeing the need for services grow. Mental health challenges are at an all-time high, and few communities have the resources they need to meet this demand. Too often, it is the most vulnerable among us that suffer. On behalf of Oceans Healthcare, we are proud to be part of this community and are excited about the road ahead. Thank you again for being here, and with that, I'd like to turn it over to Valerie Dalton to say a few words.
Hi, I'm Valerie Dalton, the administrator for Oceans Behavioral Hospital of Baton Rouge. I've been with Oceans for almost a decade. During that 10 years, I've really gotten a chance to see so many lives changed. I'm grateful to our staff who are passionate about taking care of patients and breaking down the stigma that often surrounds mental health. I really am just amazed most of the time of how selfless our staff are. They come to work taking care of loved ones like yours and mine, our friends and neighbors, people that need help, and they do it under the most difficult circumstances sometimes, like we've seen this past year during COVID-19. I also want to thank our city leaders and Baton Rouge residents for their support. These are our neighbors and friends who are helping us make mental health care more accessible for our region. I'd now like to invite Mayor Sharon Weston Broome to say a few words.
Thank you, Ms. Dalton, for the introduction. I want to begin this morning by thanking everyone in attendance for joining us this morning at Oceans Behavioral Hospital, Baton Rouge. I'm excited to see so many members of our community gathered to celebrate this milestone in our healthcare landscape. The addition of Oceans Behavioral Hospital, Baton Rouge is truly a triumph for the people of East Baton Rouge Parish, and yet another example of public-private partnerships successfully filling existing gaps within our community. Here in Baton Rouge, our residents face a disadvantage in terms of the lack of access to behavioral health care. Resources are limited and often unavailable to those in need. The need for these services has always existed within our community, but it is extremely fitting for Oceans to come to fruition in a time when our residents need it most. My administration is extremely proud to have worked with the team at Oceans, New Era's Holdings, and all of our partners to bring this behavioral health center to North Baton Rouge. Our community truly depends on this work, and I am confident we will notice the impact it has on our residents now and for generations to come.
I'm delighted that Oceans Behavioral Hospital, Baton Rouge, is now a part of our community. Their presence adds to the landscape of a growing number of physical and mental health providers located here in Howell Place. As America's population ages, the need for mental and behavioral health services continues to increase. Our community in North Baton Rouge is not any different, and families are impacted likewise. In 2014, my mother was diagnosed with vascular dementia, having had several mini strokes. I'm a mental health counselor. My sister is a licensed clinical social worker, so we were able to go far and wide to seek support over the next 7 years until her passing. However, the average family, especially in North Baton Rouge, do not have that kind of institutional behavioral health knowledge. My prayer is that having Oceans right here in our community will go a long way in solving unutilized mental health services due to a lack of knowledge as well as where to go for help. Thank you to Oceans Behavioral Health Baton Rouge for being a beacon of hope in our North Baton Rouge community to provide elements that are critical to behavioral health. Thank you.